500 children have been orphaned due to the COVID-19 pandemic in Rajasthan. Now, the state government is working towards providing a rehabilitation package for these children.
The children are one of the worst sufferers as far as the COVID-19 pandemic is concerned, not because they are largely impacted, but because many of them have lost both their parents.
There are a lot of cases where the one parent of the child had already died before, and the second surviving parent died in COVID. And that is when I remember a dadi telling us, who was taking care of her grandchildren because her bahu and beta had died in COVID. She says she has one room घर, and she says कि मैं अपने बच्चे को ये एक कमरे का घर उसकी प्रॉपर्टी राइट्स हैं, मैं इसको किसी इंस्टीट्यूशन या किसी अनाथालय में क्यों भेजूं, क्योंकि मैं हूं ना इसकी अब पेरेंट। और वो उस दादी ने 2 या 3 घर और उठाए डोमेस्टिक हेल्पर का काम करने के लिए, ताकि वो अपने पोता पोती को 7 साल 11 साल के जो 2 बच्चे हैं उनका वो अच्छे से बेटर ख्याल रख पाए। What we have to understand deeply is that as the juvenile justice law of the country also states very clearly, that institutionalization is the last resort. It has to be the last resort. If the kinship care mechanisms of the community have kicked in, they should be supported, financial scholarships, financial cash transfers. If something can be done to support the already existing systems for care for that specific child who's undergoing vulnerability, that should be our first response as a system, as a state. We know what it takes to kind of, get each state, each union territory come together on the Bal Swaraj portal to, upload the data with respect to children who've lost parents. And this has taken quite a bit of time, but it's a welcome step. But having said that, I also want to put it on record to say that this is too little done too late, because I remember when we were on the ground last year in 2021 at the zenith, literally, of the second COVID wave, we saw what was happening on the ground. We saw when children were losing parents, right? And how they have, even till date, even after a year, they're still pretty much in the same state. We are constantly seeing 2 or 3 major insights that are coming from the ground. One is that the medical needs of children are being absolutely neglected. There have been cases where children have had kidney and liver damages. They're not any children who are like really, small. They're not getting their otherwise regular immunizations. So I think there is a lot of stuff that's happening, which is not directly COVID related, but COVID impacted for sure. The second insight that we're getting from the community, a lot of the girls that we work with, a lot of the children that we work with, extremely marginalized situations, their mothers are either domestic helpers or their fathers are rickshaw pullers. Now, these children or these families don't have even the most basic documentation of an Aadhaar card or a ration card. So imagine a situation where people have literally zero or negligible incomes come down in COVID, and now they have no ration or, so there are services, there are schemes, there is a system, but they cannot do that for the want of no documentation. So it's not everything related to, hey, children losing parents. In addition to that, there are children who have just lost, they have no access to schools or their friends or their peers or digital devices for learning. schools being closed is not just an education crisis, but majority of girls are not going to the schools because no buses, no, the parents can't take the children to the school. So they are not getting access to sanitary napkins, the access to a caring teacher at the school. No longer they are having that. I think in the COVID years and now with the third wave hitting the country, child protection is in a state of emergency. अगर हम अपने बच्चों के भी नहीं हो पाए तो किसी के भी नहीं हो पाएंगे.